All right. Good afternoon, everyone. I'm here today with our Health Commissioner, Dr. DeRaza, and Police Commissioner Harrison. Let me begin by saying that the Health Commission, I appreciate the efforts made by Baltimoreans to protect yourselves, your neighbors, your families, your loved ones as we try to overcome this pandemic. And we know that there was a lot of effort put into fighting through COVID. From social distancing to masking to staying at home to everything else that was done. Think about the progress that we were able to make together. And we lost so many folks who were dear to us, but that we know without those efforts, we would have lost so many more. And now, as we are all learning more and more each day, the Delta variant is a mutation of COVID-19. It is not the same virus that we were battling at the beginning of this pandemic. It is more transmittable and more deadly to unvaccinated individuals. Over the course of the last 4 weeks, Baltimore's new case count has risen 374%, accumulating to a total of 53,789 confirmed cases of COVID in Baltimore City. Our positivity rate is also 1.7%, which is a 364% increase from 4 weeks ago and almost a 4% greater than when we last updated you all a week ago. We know that the increase in cases is not unique to Baltimore, but as you've heard me say many times, my responsibility and single priority as your mayor is to ensure the well-being of residents, and it would be foolish to not to try to get ahead of this while we have the opportunity to do so. We can act, we must act, and we will act. So in line with recent CDC guidance, Baltimore City will reinstate the indoor mask mandate for both vaccinated and unvaccinated individuals effective 9 a.m. on Monday, August the 9th. While the Delta variant is believed to be life-threatening to vaccinated individuals, it is absolutely more deadly to those who are unvaccinated and more transmittable than the initial strain of COVID-19. As we continue to push for everyone to get vaccinated, and again, everyone should get vaccinated. Everyone should do the right thing. Everyone should stop being selfish. Everyone should get their questions answered about the vaccine and get the vaccine so that you can do the things that you want to do, so that you don't have to bury a parent or a grandparent, a son or a daughter, so that everything that we love about being together will be able to happen without the fear of someone losing their life. It is also that wearing masks is a sure way to maximize protection from the Delta variant and prevent possibly spreading the virus to others. And I want to say this again. I really need Baltimore to hear me when I say that. If people will continue to die if we do not get more people vaccinated, more people will die. This is not fear-mongering. This is reality. We've lost so many more, and we will continue to lose people if people don't get vaccinated. Folks need to think about their parents, their grandparents, their siblings, their friends, their children's ability to go to school and learn in person. If you won't do it for yourself, do it for those around you, those children who are still too young to receive a vaccine but are just as much at risk. I want to be clear that the pandemic is not over. It shouldn't. We are not. There's nothing to celebrate with this pandemic being over. We must all do our due diligence to protect ourselves and our neighbors. So please take the precautions necessary to keep your family safe. Wear a mask, get vaccinated, do the right thing. For information on our walk-up sites and vaccine registration, visit covax.baltimorecity.gov. As always, Dr. DeRaza and I will continue to follow the science and allow the data to drive our decision-making as we continue to closely monitor the Delta variant. And let's continue to fight COVID-19 together, and I'll turn it over to Dr. DeRaza. Dr. D?
Good afternoon, and thank you, Mayor Scott, for your leadership keeping Baltimoreans safe and healthy during the most life-altering pandemic of our generation. Baltimore, my message today is simple. The Delta variant is here, and it poses a serious threat to our unvaccinated residents. I'm speaking to you not just as the health commissioner, but as a mother of a child who's too young to be vaccinated. We have the ability to slow the spread of COVID-19, and the actions we all take collectively will protect the most vulnerable among us. The CDC put it simply as the war has changed. That change was brought about by the Delta variant. The Delta variant is a mutation of the novel coronavirus that is almost twice as transmissible. This means that it is more easily spread than previous strains of the coronavirus. What raises even more concern is that data also suggests that vaccinated individuals infected with the Delta variant can spread this virus to others just as easily as unvaccinated individuals. This is a stark departure from previous strains of the virus, and it is a key driver in the city's decision to reinstate the indoor mask order for everyone. This increased transmissibility is evident in the rapid increase in new cases and positivity that we've seen here in Baltimore, with an increase of more than 374% compared to 4 weeks ago, and a positivity of 1.7%, an increase of more than 364% from 1 month ago. Delta is now the most common strain of the coronavirus in the United States, making up 93% of all new cases. Last week, the Centers for Disease Control and Prevention released recommendations for local jurisdictions to help halt the spread of the Delta variant. These recommendations were based on a jurisdiction's level of community transmission. Community transmission is measured by the number of new cases on a 7-day average per 100,000 residents. Based on this metric, areas with more than 50 new cases per 100,000 residents are considered to have substantial risk of disease transmission, with those with more than 100 new cases per 100,000 residents are considered to have a high risk of disease transmission. In both cases, it is recommended that jurisdictions take steps to drastically decrease the spread of disease. According to the CDC data for Baltimore City, we are now in the substantial risk category, with approximately 50 cases per 100,000 residents over a 7-day average for the time period between July 27th and August 2nd. As a reminder, the data on our public-facing dashboard lags behind by 1 week, and in the coming days, the health department will also be revamping our indicators to reflect where we are in this stage of the pandemic. Given the data, we must act in an attempt to address this surge of new cases. Therefore, as Mayor Scott stated, we will be reinstating the indoor mask order beginning Monday, August 9th. Now, as much as ever, we need all residents, vaccinated and unvaccinated, to take steps to reduce the spread of disease. Masks are an especially important means of protecting some of the most vulnerable among us who can't be vaccinated, including our children under the age of 12 and those with medical conditions for which vaccination is not an option. If you are outside your home, whether you are vaccinated or unvaccinated, you must wear a mask indoors to protect yourself and others that you may come in contact with. The reintroduction of a mask mandate indoors, combined with ongoing community vaccination efforts, will help to limit further increase in cases. To meet this new challenge posed by the emergence of the Delta variant, alongside our clinical partners, the health department is operating dozens of vaccination clinics each week in areas of the city with lowest vaccination coverage. These clinics are held during evening and weekend hours as well. All of the information on our clinics can be found on our social media, as well as our website at coronavirus.baltimorecity.gov, or by calling 443-984-8650. If you're unable to leave your home, you can also register for vaccination at home by calling 443-984-2273 or visiting covax.baltimorecity.gov. Vaccinations remain the key to helping us transition out of this pandemic. Vaccinations are still highly effective. They reduce the risk of severe disease or death from COVID by 10-fold or greater, and they reduce the risk of infection 3-fold. If you're eligible, now is the time to get vaccinated. If you still have not been vaccinated, this week, today, make steps to reach out to your clinical provider and get answers to any outstanding questions. If you don't have access to a clinical provider, please call our hotline at 443-984-8650 so that we can answer many frequently asked questions and let you know of clinics happening near you. Continuing to wait to get vaccinated puts you at greater risk of getting sick from the coronavirus. I know many of us are ready to declare victory over the pandemic and return to some sense of normalcy. The emergence of Delta and the current surge in cases nationwide reminds us we are still actively in this fight. That said, we have the tools to win this. Mask up when indoors, and if you haven't already done so, please get vaccinated. Thank you.
Thank you, Dr. D. And now we'll take some questions. Lisa? Sorry. Sorry about that.
Monday, why not do it now?
Well, we always, when we do our whatever it is, we always allow a couple days for implementation. We are not stopping folks. We know in city buildings we already have a mask mandate. If folks want to say at their local businesses they want to do it earlier, they can do that. But we want to allow folks. They're gonna be printing out signs. They're gonna be doing all of these things, and we need to allow those folks the time after we announce something to actually implement it too.
Okay. Thank you.
Thank you. Sir?
Hello, Mayor. I was going to ask you earlier, I believe this week, Anne Arundel County's executive said he didn't think he had the authority to do this kind of mandate. Obviously, you believe you do. Could you talk about that? And can you talk about how difficult it could be to enforce this?
Well, again, this isn't the first time, unfortunately, that we've had a mask mandate, and we know that we have tools for that, and we're going to make sure that we're doing that. And we're going to ask everyone also to be responsible, right? This should be something that we should be holding ourselves accountable to. We do have the authority through the powers vested in our health commissioner to issue this as a health order, and that's why we're doing it that way.
I have one more, if you could.
Yeah.
I don't know if maybe this is better for Dr. DeRaza. Do we know how many new cases are attributable to the Delta variant here in Baltimore City right now?
It's the predominant strain in Maryland and in the city, but I defer to the state to be able to release that data.
Brandon, I'm always, Mayor, to ask the question about our homeless population. It's very concerning to me. The amount of encampments that we have popping up all downtown. And I really would like to have some clarity of interaction with making sure we can be real proactive with getting these individuals not only vaccinated, but getting the vaccinations to some of them.
Absolutely, Ms. Christina. You know that we've done a lot, and we look forward to working with you to do even more, and other folks who are working with our residents suffering from homelessness to get them vaccinated, but get them the things they need, and also making sure that providers like yourselves are following the latest guidance and being able to protect yourselves and the folks who work with you, because you and your folks can't help people if you're not healthy yourself. So we'll definitely, as you know, we'll be in contact. Thank you. Emily?
Mayor, you had said you believe you have the power vested in the health commissioner. Does this require any kind of local designation of a state of emergency to make this happen?
So I'll let the health commissioner get into the details, but for us, our local one, we never got rid of. So we kept our local designation. Our local designation is there, and this is through a health order, and I'll let Dr. D talk about how that order looks and what the order says. Dr. D?
Yeah, I think the mayor touched on this. So per the city charter, Baltimore City Health Commissioner has different authority compared to some of the other jurisdictions throughout the state. So this is the power vested in the health commissioner through the city charter that allows us to put this public health order in place.
Ann?
I have an off-topic question, so if anybody else has an on-topic question, I wanted to make sure they got that. Mayor Scott, you've said that you've been an advocate for transparency and accountability within your administration. We're hearing some calls from some members of the community to see the CEO of the city schools resign and step down given the performance. 41% of high school students, 1.0 GPA for the first 3 quarters, elementary school students are not prepared. Do you agree with those calls to see the city schools CEO resign, and do you think it's time for a change in leadership?
I think that what we need is for folks to understand a couple things. That our young people were learning at home last year, understanding the impact that the digital divide has on that and the realities of a 5-year-old, 6-year-old, high schoolers, and for your station in particular, understand that if you're 16, 17 years old and you're in digital learning and your family needs you to work and you're working instead of being in school because that's the only way your family's going to survive, that's what you're going to do. And I think the school system has a very detailed plan for how we're going to get our young people back where they need to be. I think think that also as a community, especially with the fact that the kids were learning at home, we all have to do some soul searching about what we were doing to help people, for folks who were, and we know that some of the folks are just politically motivated, but for all the folks who say things like that, I want to say, how many young people did you help learn online last year? How many students did you give a computer to? How many times did you say, hey, to the kids that live next door to you, are you struggling with virtual learning? This is much deeper than one person. We know that across the country, we have seen issues like this. The system has a plan for how we're going to work with our young people, and we're going to focus on that and focus on helping our young people and not using them for political fodder. Thank you.
It wasn't just this year that we've seen this educational loss, though.
We understand, again, I know this is, again, we're talking about a school system that the state of Maryland, I would like for you guys to ask him about that, admits that it underinvested $300 million a year for more than 10 years in. We know, and we have to understand the challenges that our students have, but we also have to acknowledge the progress that has been made. We also, your station actually is the flagship station for the College Bound Foundation that helps thousands of young people from Baltimore go to college every year, but we don't talk about that. We have to make sure that we never lose sight of making sure that there's accountability at every level and that we're improving, but we also have to stop using our children for clickbait, and I won't stand for it. Next, anybody else? Thank you, everybody.